Today, we're launching an all-out plan to fight COVID-19 in our long-term care homes. We will fortify the iron ring of protection around our long-term care residents and those who care for them.
Ontario is stepping up its fight against COVID-19 in long-term care homes. The province says changes to protect the most vulnerable will be rolled out in the next couple of days. I'm Chris Ensing. Thanks for joining us. Windsor, Essex saw its highest number of new COVID-19 cases reported today. We now have at least 408 confirmed cases in our region. 59 new cases reported this morning at the health unit's briefing, with 300 tests still awaiting results. Women make up 55% of our confirmed cases here locally. 16 people have died of COVID-19 in Windsor, Essex. There were 3 more deaths overnight. 2 men and a woman, all older than 70. 10 of the people who died are connected to 3 long-term care homes. The health unit says that 2 facilities previously under an outbreak have recovered. There's now 6 facilities dealing with an outbreak in our area. Meanwhile, in Chatham, Kent, they haven't seen a new positive COVID-19 case since Sunday. They're at 25 right now. Lambton has reported an additional death overnight. 11 people have died because of COVID-19, with 119 confirmed cases. And nationally, there's 1,000 people who have died in Canada because of COVID-19. Windsor Regional Hospital says it's caring for the most COVID-19 patients on ventilators in Ontario outside of the GTA. This came out during a virtual town hall with top healthcare officials and politicians in our region to give the public the latest on the pandemic. The CBC's Jason View is joining us now live with more details. Jason, what did you learn about what it's like on the front lines right now?
Well, Chris, there are 11 patients who are positive with COVID-19 on ventilators here at Windsor Regional Hospital between both campuses, this one here on Olette and Met Campus on Tecumseh Road. And they say, like you said, that's the most at any one hospital in the province outside of the Greater Toronto area. But despite all of that, the hospital CEO today said that the overall situation is relatively stable. They have about 25 COVID-19 positive patients that they're treating for in hospital, and that has fluctuated a little bit over the last number of weeks, but has remained quite stable in the last couple of days. Here's a bit more from CEO David Mouche on the current situation.
From an equipment point of view and a ventilation point of view, we're well equipped, and we've increased our critical care capacity rather dramatically. There is regular distributions from the provincial stockpile of vents if needed. So I knock on wood, right now we're sitting well. Again, that can change.
Meanwhile, at Leamington's Hospital, Erie Shores Healthcare, they were also a part of that virtual town hall. They're currently treating 1 COVID-19 patient at their facility, but they are anticipating more. And they are also, Chris, setting up their first COVID-19 assessment center, and that opens tomorrow.
Jason, at the center of this story, we heard it very early on, are our healthcare workers looking after these patients, and some themselves are testing positive for COVID-19, some in critical condition. How are they doing?
Well, that was a part of today's discussion as well, and we're hearing that they're struggling with what they see every day, what they have to deal with inside of these walls here every day, and the fear associated with all of that. And Janice Dawson, CEO of Erie Shores Healthcare, spoke a little bit about what she's hearing from the frontline workers in Leamington.
As a small community hospital, one of the things that our frontline staff were faced with as we were preparing for this and introducing new protocols and new procedures is some of the folks out here have not been accustomed to, some of these protocols. I've talked to staff who aren't sleeping at night, who have no appetite because the stress and the anxiety is feeding into that and causing some of those physical, side effects of the situation that they're working in.
And that's why she said it's been so overwhelming to see such strong support from the community for healthcare workers here at local hospitals, regional hospitals, but also those working at long-term care homes. Chris.
Jason, we've been getting a lot of questions from our audience about how this is all playing out that they've asked us to ask officials. Now, we passed them along, but today they had an opportunity to ask them directly themselves. What stood out for you?
Well, there was one question about what would happen if there was a forced lockdown. We see that in different parts of the U.S., and they wanted to know if that's on anyone's radar here and how that would work. So Gary McNamara, he's warden for Essex County, but also the mayor of Tecumseh, he answered that question. Have a listen.
At this stage, I don't think that is necessary to use the big stick. We've seen that people are heeding to the advice of public health and are self regulating. To be heavy-handed at this stage here, I don't think it's necessary.
And circling back to what's happening on the front lines here in the overall COVID-19 situation in Windsor, Essex, the hospital of Windsor Regional Hospital today described it as fighting a war. But he did say that at this very moment that things are better than what was projected. Chris.
Thanks, Jason. CBC's Jason Vio live tonight outside of the hospital. At least a third of the province's more than 400 deaths from COVID-19 are connected to long-term care and retirement homes. Now, with the death toll mounting daily throughout our province, the Ford government has announced new steps today to extinguish what the Premier has referred to as a wildfire. But family members we spoke with worry the changes may be too late. Talia Ricci has more from Toronto.
My biggest fear is these residents are all dying alone, number one.
Helen Lee's 111-year-old grandmother tested positive for COVID-19. She lives at Mung Shang Home for the Aged, where there have been 10 deaths.
We'll see too many deaths. We need resources right now. We need nurses, we need PSW, we need housekeeping.
Today, the Premier said help is coming.
We'll go further in our testing, screening, surveillance, targeting the homes facing outbreaks. We will ensure the staff at these homes have the tools they need. That means strengthening protocols, training, and education on infection prevention and control.
All symptomatic staff and residents at long-term care homes will now be screened, as well as any asymptomatic residents or staff who came in contact with someone with the virus. Ford says PPE will arrive at long-term care homes in need within 24 hours, and that COVID-19 SWAT teams have been formed.
Drawn from our hospitals, home care, and public health care units to help homes manage outbreaks.
St. Clair O'Connor community has lost 7 of its 25 residents. Like many long-term care homes, staffing has been one of its biggest challenges.
One of the things I think that really important for people to understand is people on the front line are human, and every one of us are bone tired, and we're fearful for the residents that we're looking after.
The province says some hospital staff will be redirected, and it's also matching retired healthcare workers, students, and internationally trained professionals with short-staffed homes. Today, the Prime Minister said the government is working to boost wages for those caring for the vulnerable residents in these difficult conditions.
Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities.
Families waiting to see these promises turn into action say every minute counts.
Lives are at stake. These seniors deserve better.
Talia Ricci, CBC News, Toronto.
19 low-risk offenders at the South West Detention Centre have been granted early release because of COVID-19. Now, the detention center says it's trying to reduce the inmate population during the pandemic. The offenders who were released were close to the end of their sentences, with 30 days or less left. Officials say inmates who qualify will be notified, and then they have to agree to the terms and conditions of their release before they can go. Windsor's fire department has had to deal with some big changes in staffing because of COVID-19. 4 of their members have tested positive for the coronavirus, but more are off because they need to self-isolate. 23 members are currently off because of the pandemic. To be clear, they have not tested positive for COVID-19. It's either because of self-isolation through travel or close contact. In total, more than 80 members have had to take time off work. They still have to staff stations and fire trucks, so they've been bringing in firefighters on off days, working overtime. A deputy chief says that the department can still respond to calls appropriately. In total, 14 firefighters have done a test for COVID-19. That's since the pandemic started. And again, of those, 4 members have tested positive. 1 is back to work. Another should be back shortly. The other 2 had recent positive tests. And there's still 1 standing test that has to come back. 9 members are negative, but they're continuing to wait for the results of that 10th test. Most businesses have had to find ways to adjust in order to survive this pandemic. Some of the new demands have meant embracing technology. Now there's a new program aimed at helping to make those adjustments. It's called Epic Nimble. But as the CBC's Amy Dodge explains, not everyone can get that funding, and that's meant taking things into their own hands and getting creative.
This small art shop had big plans for April. It was going to introduce pottery to its customers. But just as supplies started to pour in, and before it could fire up the newly purchased kiln, it had to close.
It was just a shock. It was just kind of like, whoa, like what's going on? I have to shut down. Like I just got this up and going and booming. And then, you thought maybe it was just going to be for a week or 2. And now it's been like, a month? And they're saying it'll be another month, and it could be a lot longer, right? So I was definitely really sad.
Chevalier had to adjust her business plan to try and make up for the money she just spent on the pottery. Her solution? Home deliveries and weekly online classes. The company is doing porch drop-offs with pottery. Once painted, they pick them back up and fire them in the kiln, then deliver them back to the porch. It's an innovative service, but it isn't helping her business to prosper during these times.
The rent and the bills and the stuff, it's definitely not keeping the business floating completely, but it's helping, with, paying up that pottery off, and I'm still paying the kiln off. So I'm not like really in the pluses or anything here.
Well, this is a small innovation. Chevalier says it will get her through a few more weeks, but not a few more months. Sketch is among several small businesses trying to survive this pandemic.
This project is quite a short term.
Epicenter and other community partners have launched a program called Nimble. 5 small businesses in Windsor, Essex will be chosen. Those businesses will receive $4,000 each to pivot their business towards using technology. But since Sketch is less than 2 years old, it won't qualify. Those running the program say it's because businesses over 2 years old have an established track record.
They have already know what they're doing. They understand their business and they understand their customers.
The program and Chevalier have the same goal in common, that using technology will open new revenue streams and change the way Windsor does business once these doors are open again. Amy Dodge, CBC News, Lakeshore.
Now, she's not the only artist in Windsor that's dealing with a tough blow because of this pandemic. Theaters, live music venues, galleries, all closed because of COVID-19. Physical distancing measures, they're taking a financial toll, with some local organizers wondering how they're going to make rent.
It's frustrating. It's hard because, we need to produce shows to pay our rent, and if we're not doing that, and we can't have fundraisers or we can't get sponsors for anything, so we're really, really concerned about where we are lying. And I know it's not just us. I know a lot of other theater companies in this city are in the same boat.
Now that's from a panel that happened this afternoon with the City of Windsor. They're making art funding available to people in our community. There's $60,000 available. Poets, comedians, the list who comply, it's pretty long. Approved projects could get between $500 and $1,000. Now that project, whatever it is, it can be a live stream performance between 45 and 60 minutes. It could include a tutorial, a workshop, classes could be part of this as well. It doesn't have to be live, but the city says it needs to be accessed virtually and available to the public or presented before the end of June. The applications can be made online. It opens on Friday and it closes next Friday. Spring weddings are being pushed back as couples try to make sure that the pandemic doesn't ruin their special day. Kate Ryan was supposed to get married on May 2nd at Sprucewood Shores Estate Winery in Amherstburg, but after COVID-19 hit, she had to move her wedding to the fall.
And we actually had moved everything and called everybody. Like, that's kind of when I sat back and I realized what we just had done. And I just, I broke down. Telling my parents, I think, was like the hardest part because, I think I'm the only child and this has been their dream as much as it's been mine. So I think hearing both of my parents cry on the phone and not being able to comfort them, I think that was it was devastating.
Ryan still plans to get married at the winery when the time comes. She's about 90% of the vendors were able to help her out by waiving cancellation fees, but she says she understands the difficulties that small businesses are having at this time. Folks in Michigan made noise today to protest the state's stay-at-home order. The group took a stand outside the state capitol in Lansing. They're targeting the cost of the government's order on the economy. They want Gretchen Whitmer to look at safe ways to open more businesses. But the governor says right now, everyone needs to do their part to flatten the curve. This is a big part of it. Across the river, the TCF Center is now open as an alternate care facility for COVID-19 patients. It was put together by the U.S. Army Corps of Engineers and can house hundreds of patients. The first 25 patients are expected to arrive by the end of the week. Now, this has been an extremely stressful time for seniors. We told you about that tonight, especially for those living in long-term care homes where outbreaks are happening more often. But two women in Windsor, Essex are looking to put a smile on the faces of seniors during this difficult time. As the CBC's Sanjay Maru explains, they've done something through virtual mail collections.
I still wanted to find a way to connect and to bring some hope and encouragement to all of the seniors who are really struggling in the face of this.
Emily Truman is no stranger to warming the hearts of seniors through handmade cards. Throughout the year, the 16-year-old from Lakeshore collects them from the public, even making some of the cards herself for seniors. And the COVID-19 pandemic isn't about to stop her now.
I love volunteering, and there's always been some vulnerability, some isolation, especially among those in long-term care and retirement homes. But also, they're just such amazing people, and they're not often heard, their voices, and they don't often get as many visitors as they should.
Her project is called Virtual Happy Mail. You simply write up your letter, scan it, and email it to Truman. From there, the letters are forwarded to long-term care or retirement homes, along with Meals on Wheels staff. And she's not the only one.
We've been receiving letters, notes, poetry actually, from members in the school community and also in the broader community.
Hammond started a similar initiative about a week ago. You simply fill out a Google form with well wishes like this. You are a trooper. You have seen so many good and bad events in your lifetime that COVID-19 is just another bump in the road.
I actually also used to work as a kitchen helper years ago at a senior's home. So I just started thinking about those memories and how I enjoyed, chatting with the residents there. And I wanted to be able to give back.
Hammond says she started the initiative after reading an article about COVID-19, but Truman has a more personal connection. Her grandmother is currently staying at a long-term care home where an outbreak is taking place, so she understands that gestures like these go a long way. Sanjay Maru, CBC News, Windsor.
Now, we heard from many of you during our call out of that We're in This Together campaign. So here's a sweet video that we received from a young girl with a musical message.
And the truth, love is all we need. We are the world. We are the children.
We all know that tune. Chloe's grandma lives here in Windsor, and the family hopes that this video can bring a bit of joy while folks are staying at home. She wants to send her love and appreciation to frontline workers as well. I'll get out of the way and let Chloe take us to break. Strange times, surely, but there's some strange weather today as well. I'm sure you noticed it already if you looked outside your window. I think it's still snowing outside there if I take a peek through our window here. I tried to put this video in slow motion here, and you know, the little black bars looks a little cinematic. I thought maybe it would be a little nicer if we just enjoyed the snowfall that way, because after all, it is. Well, actually, let's bring in Clark Kennedy. Clark, we played Day of the Week. What day is it? What month is it now? Because that's not usually an April thing we see.
Yeah, well, this is the problem. What happens is when you get spoiled. So we've been kind of spoiled. It wasn't that bad of winter. Spring was kind of mild. So here you go. We get a little upset. You're the one who said those look beautiful. I believe that's what you said on Twitter. How
calming, right?
Pretty.
Deep breath, and then you look outside and you,
There it is. Well, yes, it gives us reason to pause and want to stay inside or stay home. So there's something, I guess, positive about it. Well, and the temperature on the positive side of freezing, 1 degree, barely holding on. Chatham-Kent, you're at freezing. Sarnia at 0 as well. The wind's a little bit lighter now, but still we are looking at there being that feel in the air of it being cooler. So -2 for Windsor, Chatham-Kent feeling about -4. And there's, see these pockets of, I want to say flurries, but at times you're getting a little bit more significant with some little periods of light snow here coming through. And that's going to carry on for the next couple of hours. And then we'll see things kind of dying off through the overnight. And we start off pretty quiet tomorrow, but then isolated flurries possible. And what's even more important to that than that is tomorrow night into Friday morning. System that's pushing just to the south, likely going to bring some light flurries or even a dusting of snow through, changing over to a mix as we get into the afternoon and the temperatures warm up. But the tracking is going to be really important with that one, so I'll be watching that carefully for you. Tonight, our low goes to -4, feeling more like -8. And tomorrow, this is about the best we can do. We should be really double that in terms of our afternoon highs, but hey, 6 degrees is what we have. Friday, especially early in the day, we could see some wet conditions moving through. And then I think you're going to like this a little better as we go towards the weekend, Chris, when we get back to some double digits coming our way.
Not bad. Makes those walks easier. Thanks, Colette.
You're welcome.
Now, coming up, we are going to take a look at the World Health Organization and what's going on between them and the United States. The head of the World Health Organization says that he regrets Donald Trump's decision to cut off funding to the UN Health Agency. The United States is the WHO's largest donor and has contributed more than $400 million annually.
This is a time for all of us to be united in our common struggle against a common threat, a dangerous enemy.
Many world leaders and health experts have expressed alarm over Trump's sudden move yesterday in the middle of the pandemic. Trump has been facing criticism for his administration's domestic response to the outbreak. He's accusing the WHO of mismanaging and covering up the spread of the coronavirus when it first started in China. 6:29 p.m. and that's it for CBC Windsor News. We want to leave you here with a look at our city, the closed signs as we continue to deal with the effects of COVID-19.